Today, folks, we're diving into the future of Preveceuticals with CEO Stephen DeVenter. Welcome, sir. Appreciate your time.
Hello, good to have you today. Thank you.
This is going to be great. So basically, I was going through your guys' pipeline, and from cannabinoid oil to dual gene therapies, the pharma sector can be very complicated for newer investors to kind of grasp, but obviously can have profound effects on people's health and even obviously a profitable effect from a stock standpoint. Can you just briefly explain what your pipeline looks like right now to a newer investor?
So ultimately, we have 4 different programs. The first program we have is a blue scorpion venom. We've created a synthetic version that we've seen some really promising work that it can help with cancer, especially brain cancer. So we've done all the preclinical trials on that and developed it, and now moving it forth to start going to clinical trials. The second program we have is a sol gel, which is a liquid that you spray in the nasal cavity and gels immediately. Once that gels, it will sit there for up to 7 days, and we can time release with nanoparticles or nanobubbles the cannabinoids at the right dosage required. And that can be used for any different ailments depending on which of the cannabinoids you infuse with it. The third program that we have is a painkiller that's much more stronger than any type of opioids or morphine, except you cannot create tolerance, which means you don't have to take more and more pills as you get used to it. You cannot get addicted to it, and you cannot get high, and you cannot overdose. So we're looking to seek to break into the opioid market, into something that's as strong or stronger without all the nasty side effects. And then lastly, we have dual gene therapy, where we have identified a certain gene in your body that is responsible both for obesity and diabetes 2. And we have now got a technology that we can silence that gene to be able to reduce your weight and diabetes as well. Oh, wow. And funny enough, as with these other vaccines nowadays, they're using mRNA. So they're using mRNA, which means a medium-sized strain. We're using siRNA. So we started this quite a few years ago, knowing that RNA technology will become something of the future.
This is pretty profound, man. I don't think people are really recognizing the full renaissance that's happening in the healthcare sector. And you guys got one heck of a fascinating pipeline approaching some pretty broad healthcare markets. So in your recent news filing, I guess we'll touch base because Preveceutical received 315,000, euro dollars for research and develop tax incentives. That was a cash refund. Can you kind of explain the idea of that just to clear some things up?
So in Australia, we actually have quite a good relation with the government, and they have a specific program for research and development in the pharmaceutical industry. And so any type of R&D we do to develop new technologies and drugs to assist people, we can actually file not for a tax credit, we actually get a cash rebate. So if we spend $1 million this year, we get 43% of that in cash back. We'll get a check for $430,000. But it's not a tax, against the income you get, it's a cash rebate. So this year we received that $315,000 for last year's work.
That's great to hear. So in that kind of same note, when you're talking about like the Australian government, because I know with like, say, psychedelics, for example, a lot of those drug trials are being ran outside of the US where they're more friendly trial-based countries. Are you guys finding similar circumstances? Are most of your pipelines coming out of Australia then?
It's interesting to say that, because before I started working in Australia, which has been probably about 6 years now, we've been doing a bunch of work there, 5 years. I always thought Australia was very outgoing, but they're very conservative. They're extremely conservative, much more so than I would have thought compared to North America. However, when it comes to, especially in Queensland, the state that we're in, they're very pro-technology-driven pharmaceuticals and medical industry. So they're conservative in the day-to-day views, but they're willing to look at further development of things in contained situations. So it's been very, very promising for us to do this in Australia. They're all very interested in moving things forward. Because it's a slightly smaller country of 25 million people rather than Canada of 36, 37, or the United States of 330 million people, we actually are able to talk to government. Like I could actually have a conversation with the health minister. When I was involved with Aurora, in the beginning, we tried to talk to Rono Ambrose, and you had no problem getting hold of Health Canada. Never mind the health man, the health minister. So yes, they're very, very hands-on and willing to move things forward.
That's awesome to hear. Do you mind just touching base quickly too, because obviously a lot of the drug pharmaceuticals are centric around the US and getting those filings done. So when you guys get through those filings, say in Australia, does it follow similar guidelines, and are you guys able to expand those patents obviously out into these other countries and further expand the actual the logistics behind it?
Absolutely. So that's one of the good things about Australia. So in Canada, we have the Health Canada. In the United States, you have the FDA, the Food and Drug Administration. In the Australia, they have the TGA, which is the Therapeutic Goods Association, which is very similar to other organizations. They actually have some of the strictest regulations in the world. And so here in Canada, we need to have GMP. In Europe, you have to have EU GMP, which is more stringent.
Yeah.
Australia is on the EU GMP standard as well. So Europe prefers any drugs that come out of Australia. That's their preference. They prefer that because of the TGA's regulations. And so the TGA, if we have any of those type of approvals, the FDA, Health Canada, and any of the European Union's health officials totally will accept all of those findings. But of course, they would review it to make sure it's there. But yes, it's very, very strong.
Well, that's great to hear. I really appreciate the update, Stephen. Is there anything else we can look forward to over the next coming month, or is there anything you're really excited about these coming weeks that we can look forward to chatting about soon, hopefully?
Well, we should have a few things coming fairly soon. Now that we've got these at the end of our programs, we're now moving into commercialization and further clinical trials. And it's a little slower this summer in Canada here because of everyone had their shackles off from COVID, and so people went away for holidays, etc. But coming into the fall now, we should see some acceleration of those programs, potentially some clinical trials now, things which we'll inform you of soon.
Well, that's great to hear. Thanks so much, Stephen. We'll leave the tickers up here for everyone to take a look at as well. And we look forward to catching up with you in a week or two and hopefully get some more great news coming out.
Sounds good. Thank you very much for having me today.
Stay cool. Stay awesome. We'll catch you all next time. Cheers.
Thank you, man.